Hey everyone, I'm Nicole, an occupational therapist, and together with Stephanie, the physical therapist, we are the Note Ninjas. We help PTs, OTs, and assistants with treatment planning and documentation. So today I want to talk to you about patient-centered care. So patient-centered care, I know like with our busy schedules and high productivity, a lot of people kind of just go through the motions and do the same things and sometimes don't always incorporate what the patient actually wants, the meaningful activities. And really that's what it's all about for PTs and OTs. If we're not doing this, we're really doing our patients a disservice. But the thing is, it doesn't have to be complicated. We don't have to like really dig for somebody's passion in order to, if they don't have as much motivation, maybe they're in assisted living or a certain setting that kind of limits them for doing some things that they love. We don't have to always go like searching for that. Sometimes it just comes to us. So I'm going to give you an example. I had a patient who we are working on balance, ambulation, functional mobility. He's had multiple falls. He was a little bit confused. So we were really working on that dynamic standing balance, reaching, just so he could be more safe with his ADLs and his everyday activities. And one day I was just talking to him and I found a camera in one of his drawers. He was like, oh, he asked me to go look for something. And I found this camera and I asked him about it. I'm like, "Oh, do you use this camera?" And he said, "Oh, I used to love taking pictures, but I don't really use it so much anymore because I have nowhere to go. I have nowhere to take pictures." And this man was living in an assisted living facility. So at the time during this treatment, it was actually the holidays. So I kind of thought about it. I was like, you know what? All the doors are decorated with different wreaths and different holiday decorations. I'm like, why don't we go and take pictures? That way, we're working on functional mobility. We're focusing on visual scanning, head turns. Maybe he didn't have a fine motor goal, but that didn't matter because there were so many other things that we were working on. And it was so functional, so meaningful to the patient. And honestly, that session, it allowed him to walk the greatest amount of distance that he's walked for us because he was so distracted because he was doing something that he loved and it brought him so much joy. And I just think this story is such an important reminder to physical and occupational therapists that during our busy seasons, which is all the time, during those high productivity, all it takes is one thing to really connect with our patient and to really make it more meaningful for them. So, and then to document it, you're just tying it to a goal. We were focusing on functional mobility and balance. He's working on trunk mobility, he's working on core stability, he was reaching, he was head turning, visual scanning, all those things I added to the note that we were working on. So it is absolutely justified, and you just have to be a little bit more creative with your documentation. So, in order to maybe learn a little bit more about how to document that, make sure to keep following us and subscribe to our channel, The Note Ninjas, and join the Note Ninja membership for treatment ideas just like that with the documentation.